One common thing that develops for most patients given enough time after cataract surgery is cloudiness in the membrane that previously held your cataract in place. We purposefully leave that membrane in place at the time of cataract surgery because we need that membrane to hold onto your new lens implant and help it seal and heal into place to stay there for your entire life. However, the back surface of that membrane very commonly becomes cloudy as the months and years go on after surgery. But don't worry, if that occurs, which it often does, we treat that with a very quick and painless laser procedure called a YAG capsulotomy. That laser is more like an eye exam than it is a surgery. Your chin will be resting in a chin rest, very similar to the chin rest and the bright light that you see during a normal eye exam. In fact, the laser looks almost just like the microscopes that we typically use during our eye examinations. You'll hear some clicking noises for about 30 to 60 seconds. You can even drive yourself home the same day. It's nothing like the cataract surgery itself, where we initially remove that cataract, but we want everybody to know about this procedure just because it's so commonly needed at some point in your life after procedure that we like to inform you about that ahead of time, even before the cataract surgery is done.